We live in a world that increasingly has come to be defined by facts, figures and statistics. In that part of our planet we call the developing world, the business of providing help to those who need it most is to a large extent driven by those statistics and how they're interpreted by experts. But the world isn't black and white, it's blue and green and brown and yellow. And behind the numbers are people. Many of those people face huge challenges just to stay alive. In Guriapata, a remote village in the Indian state of Orissa, Subhasini Jani plays with her newborn baby, Amarnath. With the numbers stacked against her, she has successfully defied the odds so far. But in a state where the health service in rural areas is patchy at best, the road ahead is rough. If she or her children fall ill with even the most treatable of ailments, the consequences could be fatal. Innovations is an initiative run by Concern Worldwide. Its basic aim is to run campaigns in a number of different countries seeking ideas from the public on how to improve maternal, newborn and child health services. The Innovations team set up in Orissa in late 2009. Their first task was to research a challenge statement for use in a nationwide advertising campaign.
From Malawi and Sierra Leone, we learned that the outreach activity should be focused more because it helps in having a face-to-face conversation with most of the individuals, and we can cover a variety of stakeholders.
We selected 5 districts and 2 cities. We went to these districts and had events with these 8 to 9 target groups, range of faith-based organizations, media, NGOs, students, because we found that in Malawi students have given fantastic ideas, so we thought that let us also have events with students here, and private sector, because they could give us some out-of-the-box ideas.
All of the entries were screened and assessed by an independent panel of experts, and after a lengthy process, 18 ideas were chosen to go forward for judging at a semi-final event. The semi-finals took place in the state capital of Bhubaneswar. Almost 38 million people live in this state. For some of the participants, the journey here could be measured in days rather than hours. A number of them came from tribal districts, the remotest and poorest parts of this vast state. Presentation skills training was provided along with one-on-one coaching to help those taking part prepare their presentations. Among the 18 semi-finalists in Orissa was Deshanti Maji. She says that for a woman it's like a curse to be born in the tribal belt. We are forgotten by the health services and we are dying. 2 weeks ago, Deshanti's sister-in-law, who was 6 months pregnant, started to bleed. There are no proper roads in the hills, so the family had to carry her to the nearest health clinic on a bed. On the way, she lost the baby. 3 ideas were selected by the judges using strict criteria, and these would go forward to a final stage. Mentoring was provided to help develop the ideas. Eventually, one idea was chosen. It came from Dr. Maji, a student from Mundra Beda. His idea is to recruit and train men to be paired with female health workers, the aim to increase security when travelling in remote areas, and to raise awareness and involvement of husbands and fathers around key household practices. The Innovations team will now work with Dr. to further refine the idea and move it towards implementation. Back in Guriapata, Subhasini nurses baby Amarnath. They live in a tribal district. The chances of getting sick are high, and the chances of getting proper medical treatment are poor. Innovations is a chance to make a difference to the lives of mothers and children across Orissa. A chance to make the future brighter.